morning again. Linda asked me to say a few words today about the absurdities of the continuing use of asbestos. My work has taken me literally all over the world. We've learned that it may not be used much in this country anymore, but it continues to be used, and I've got a few thoughts I would like to share with you. So, as I said, I'm going to talk a little bit about asbestos absurdities. And so I'm just going to share a few thoughts over a few quick minutes with you. It's absurd to think that the world still uses asbestos. We've just heard of its long history going back into the 30s and the lawsuits going back to the late 60s into the 70s. But around the world, we still use some 2 million tons of asbestos per year. It continues to be taken out of the ground. Major places that it gets mined continue to be Russia, Kazakhstan, China, some in Brazil and elsewhere. And as recent as 2012, we note that there's still, as I said, 2 million tons a year being used. This gives you some idea of where it is used. I've done work on asbestos in both India and China, and those two countries alone account for a bit over 50% of the world's use. Not surprisingly, in places like India, the continuing use of asbestos cement continues because many of the members of parliament are the people who own the asbestos factories. But you see that other countries, Indonesia, Russia, and elsewhere, continue to use asbestos, and even Sri Lanka makes the list, where I'm finishing up a project with some colleagues over there showing that, not surprisingly, they have disease just as elsewhere it can be found in the world. You know this figure, of course, that the World Health Organization has estimated that over 107,000 deaths from asbestos exposure occur yearly in the world. That is a number that continues and unfortunately is still with us. So, it is absurd not to recognize history. If we don't recognize history, we are fated to make the same mistakes. This is a slide from a piece of tissue cut in the year 1899. There is a couple of asbestos bodies there. This is a gentleman who at 36 was the last of 10 young men working in an asbestos textile plant at the East End of London. And his physician who did his autopsy, Dr. Montague Murray, wrote, "One hears, generally speaking, that considerable trouble is now taken to prevent the inhalation of dust, and so the disease is not so likely to occur as heretofore," 110 years ago. But as we stand here today, we know that this is the spectrum of asbestos-related disease. Non-malignant disease, minor problems like asbestos warts, but asbestosis, which still in some groups like insulators account for 10% of deaths. And then all the malignant changes, lung cancer, mesotheliomas, GI tract cancers, and the others that you see there. Another absurdity, and we see this around the world, is to argue that chrysotile does not cause disease. It's those bad amphiboles. It's not this nice chrysotile stuff. And how do we know that? Well, here's some rats that were given inhalation. We certainly know a lot from people, but if you look down that list, chrysotile caused 16 lung cancers and 4 mesotheliomas, and Canadian chrysotile caused 17 lung cancers and 4 mesotheliomas. It's also absurd to argue that there is a safe dose. We know that the only safe dose of exposure to asbestos is 0. And how do we know that? Again, from that same inhalation study, as little as 1 day of exposure gave rise to lung cancers and mesotheliomas in animals. We have a few case reports of literally 1 day of exposure in humans giving rise to mesotheliomas, and work of Dr. Selikoff looking at the UNARCO facility in Patterson, where he sort of got his start on the asbestos problem, showed that working a month or less, a week, 2 weeks, a month, doubled your risk of lung cancer. And by 2 months, you were up at a 3-fold increased risk of getting lung cancer. So it doesn't take much asbestos. Along with this, it is absurd to sell cigarettes overseas. We shouldn't forget that there's this linkage, as we see here, between asbestos exposure in cigarettes. If you don't smoke and don't work, you have a low chance, but a small chance of getting lung cancer. Asbestos by itself gives you lung cancer. Cigarette smoking by itself gives you lung cancer, but we've learned if you put the two together, the combination is explosively problematic. It's super additive, it's multiplicative, it varies by where you look at data, but clearly if you continue to smoke while you work with asbestos, it extraordinarily raises your risk of getting lung cancer. And while we continue to see asbestos sold around the world, we still see the United States and other countries pushing the use of tobacco. So it's absurd not to discontinue the use of asbestos everywhere. What do we mean by that? We may have rules in 55 or so countries now that ban the use of asbestos, but it's not true everywhere. As the world has gotten smaller and economically smaller, health and safety standards are not the same all over the world. It's also absurd not to collect data. As we learn in public health, the absence of data does not mean the absence of disease. And so when the Russians now stop collecting data on mesotheliomas and then get up and say, we have no mesotheliomas, or in India, where the government says they've never recorded a mesothelioma, but one cancer hospital alone treated 32 mesotheliomas in 1 year, the fact that you don't collect the data doesn't mean that disease is not there. And lastly, it's absurd not to prevent disease. Thank you very much.